what we do in medicine, can you give us a layman's speak about what this bill will do in terms of medicines and off into the future, some sort of
Sure. I think, the quintessential example would be Malachy Institute and their CAR T-cell therapy. I believe you may be meeting with them later today. It's a great example, I believe, of the 3 GMOs released into the environment under HESNO. I think Malachy's had 2 of those 3. Their initial 2022 application that they gave them permission to modify the T-cells, and then their 2024 application that let them go to clinical trials. This is an exciting piece of research, an exciting endeavour, and at the moment we're cutting edge in this technology. It seems like we can point these killer T-cells at precisionally defined cancers, and amongst other things, get less side effects than other remedies and other solutions. This is an exciting thing. We're into phase 2 now. We're to enroll 80 people. They enrolled 8 as of 2 weeks ago. This is leading edge. This is sort of the definition of precision medicine, where you can specifically identify a treatment just for you, just for your cancer, just for your B-cell lymphoma. These killer T-cells can attack that. Now, without the advances that we're looking to make in this bill, and Melanie may go over this as well, but some of their approvals took a year to get through. I believe the first approval, maybe it was the second, took a year to get through at a cost they estimate about $250,000. That's not insignificant. They were able to progress, but again, maybe they'll raise other examples of international studies that they wanted to be a part of, and because of our restrictive regime, they either had to pull out or not have to participate, and they've raised the question of reputational damage to our science sector by not being able to participate in those sort of studies. So real opportunities in the medical and health space for what a modernised gene technology bill could do. And I just give one example with CAR T-cells.
Thank you.
Okay. What do you think about Jenny Marcroft's question?
I actually thought it was very relevant, and it does go to the heart of this bill. And the answer that Shane Retty gave us was that the Mulligan Institute is doing a GMO study. It's in its phase 2 effects, and it's going to look at the health and safety, what it is. So all medicines have to go through clinical trials up to 3 or 4 stages. In New Zealand, we have actually, through the HESNO Act, approved 2 telemycin and Paxlovid. That was a liver cancer drug, which had to be pulled after 18 months because the side effects were so serious, and 45% of the people dropped out. The telemycin was never actually started in this country. The CAR T-cells, we'll see whether they are actually safe, but they are different because they use the person's own genetics, and that is genetically modified, and then it's given back to them. And so what we're looking at is an obfuscation of he's really just trying to pretend that this bill will go further than what we already have. But he's not actually realizing that already the medical institutions to put something on the market needs these things. And they all cost around about $250,000 to conduct. So it's actually a moot point, and he's trying to pretend that we aren't doing it already, and this bill will release it. So it's absolute rubbish.
Well, I'll just say, keep it in the lab.
Keep it in the lab.
Thanks for watching. Make sure you're subscribed to our Facebook, YouTube, Twitch, Instagram, TikTok.